Hello student, myself Digan Sakhiwala. I am your science sir. Today we will continue chapter number 13, why do we fall ill. Dear student, today we are going to learn about the principle of prevention. In that we will learn about the different type of vaccine and vaccination. So we will start. Principle of prevention. There are three limitations of principle of prevention to be dealing with the infectious disease. So whenever we are dealing with the infectious disease, then prevention is very important. So in that also three limitations are there. There are three limitations of principle of prevention to dealing with the infectious disease. The first is that once someone has disease, their body functions are damaged and many may never recover completely. Okay, so first is that once someone has disease, the body function is totally damaged and maybe it will not recover easily. The second is that the treatment will take time, which means that someone suffering from the disease is likely to be a bedridden for some time, even if we can give proper treatment. Okay, as well as for the some treatment, what happen, the patient has to take bed rest and maybe it take more time. Okay. The third is that the person suffering from an infectious disease can serve as a source from where the infection may spread to other. And third is very dangerous in that the person who is suffering from the disease, he became a super spreader, like corona, in that the person who is suffering from the corona, he does not know that he is suffering from the corona. Where he is going, he infect the other people. Okay. This leads to a multiplication of above difficulties. It is because of such a reason that prevention of disease is better than cure. So because of these three reasons, okay, prevention of disease is better than cure. Okay. The third is that the person suffering from an infectious disease can serve as a source from where the infection may spread to other. There are two ways, one general and one specific to each disease. The general way of preventing infection mostly related to preventing the exposure. So here very important thing is that whenever we want to prevent the infection, then is mostly related to preventing the exposure. We have to stop exposure of the infection. For airborne microbes, we can prevent the exposure by providing living conditions that are not overcrowded. So we should not go in such a condition where the people are in a more numbers. Okay, for airborne microbes, we can prevent the exposure by providing living conditions that are not overcrowded. Where people are together, we should not go. Like in corona, you should not meet with so many people in crowded area, so it cannot transmit from one person to another person. For waterborne microbes, we can prevent the exposure by providing the safe drinking water. This can be done by treating the water to kill any microbial contamination. So when the waterborne microbes are there, to prevent the exposure, we have to use a safe drinking water, or we have to drink the boiled water. This can be done by the treating the water to kill any microbial contamination. For vector-borne infection, we can provide the clean environment. This would not, for the example, allow mosquito breeding. In other words, public hygiene is one basic key to the prevention of infectious disease. Other thing is that we have to maintain the public hygiene. Okay, so we can avoid the more population of mosquito. Okay, we will not allow the mosquito breeding. In other words, public hygiene is one basic key to prevention of the infectious disease. Okay, so we have to maintain cleanliness and hygiene in our city and in our area. There are some general principles to prevent the infectious disease. If someone is suffering from the cold and cough in the class, it is likely that the children sitting around will be exposed the infection. Okay, so we can say that if very small children are there, we should avoid the children to go nearer to the infected people, okay, or the patient, because the child immune system is poor compared to the young one. Okay, so they are easily become a carrier of disease, or they are become a spreader of disease. This is because the immune system of our body is normally fighting off microbes. We have cells that specialize in killing the infecting microbes. These cells go into action each time infecting microbes enter the body. if they are successful, we do not actually come down with the any disease. In our body already the immune system is very powerful, so if the microbes are enter, bacteria, virus, if any are there, then our most probably our immune system fight with it. Whenever the old people are there or the small child are there, their immune system is poor. So suppose microbes are enter in their body, they have not capacity to fight with them. The immune cell managed to kill off the infection long before it assume major proportion. So normally what happen, immune cell manage to kill off the infection long before it assume the major proportion. So one way of looking at severe infection disease is that it represents a lack of success of immune system. The second basic principle of prevention of infectious disease is the availability of proper and sufficient food for the everyone. So second thing is that everyone should get the proper food, okay, proper and healthy food. Whenever we get the proper food, then we get the enough nutrients, like we get the carbohydrate, protein, fat, vitamins in the proper amount. If the enough food is or proper food is not available, then what happen, automatically immune system is become a down, and it is a more chances that we will suffer from the different type of diseases. These are general way of preventing infection. What are specific way? They are relative to a peculiar property of immune system that usually fight off microbial infection. So second way in that what happen, whenever we think about the specifically, then we have to do the vaccination or we have to apply, we have to give some medicine, then actually we can easily fight against the different type of diseases. These days there is no smallpox anywhere in the world, but 100 years ago smallpox epidemic were not at all uncommon. So before 100 years there was a problem of smallpox, okay. Nowadays there was that much not problems are there, okay. In such a epidemic, people used to be very afraid of coming nearer someone suffering from the disease, since they are afraid of catching disease, okay. So in such epidemic, people used to be very afraid of coming near to someone suffering from the disease, since they are afraid of catching the disease. Those people would provide a nursing care for the victims of smallpox. This was a group of people who had smallpox earlier and survived it. So what the people find, those who are giving nursing to the patient, okay, they were also suffering from the smallpox, but once they suffer, automatically their body get the immune system, okay, their body get the defensive power against the smallpox. So second time they are not suffering from the smallpox. If you had the smallpox once, there was no chance of suffering from it again. So having the disease once was a means of preventing subsequent attack of the same disease, okay. So if we are suffering from the smallpox once, then second time in our body, automatic it get the immunity or it get the defense power. So because of that reason, second time there is no possibility of suffering from the smallpox. This happens because when the immune system first see an infection microbe, it respond again it and then remember it specifically. So what happened, first time we will suffer from any type of disease as the microbes enter in our body. First time what happened, as the microbe enter in our body first see the infection of microbe and it respond again it and then remember it specifically. So the next time that particular microbe or its close relatives enter the body, the immune system respond with the even greater vigor, okay. So second time when the microbes enter in the body of same disease, then what happen, our immune system is become alert and it produce the chemical or hormone against that type of disease, okay. And because of that reason, what happen, our body can fight with that disease very strongly. This eliminates the infection even more quickly the first time around. This is the basis of principle of immunization. So this is the basis of the principle of immunization, in that our bodies get the more and more immunity, okay, and this eliminates the infection of even more quickly the first time around. Many vaccines are now available for preventing a whole range of infectious disease and provide the disease specific means of prevention. Many vaccines are now available for preventing a whole range of infectious disease and provide a disease specific means of prevention. There are vaccines against the tetanus, diphtheria, whooping cough, measles, polio, many other. These form the public health program of childhood immunization for preventing the infectious diseases. Okay, so many vaccines are available like tetanus, diphtheria, whooping cough, measles, polio and many other. These form the public health program of childhood immunization for preventing the infectious disease. So once they get the vaccine for this type of diseases, in future they will not suffer from any type of disease. Such a program can use useful only if such health measures are available to all children. Okay, so such a program can be useful only in such a health measures are available to all children. So nowadays we are not getting any, most probably we are not getting the patient of polio because vaccination is very powerful in India. Okay, some hepatitis virus which cause jaundice are transmitted through water. Okay, so jaundice generally spread through the water. Okay, they are to hepatitis virus, they are spread to the water. There is a vaccine for one of them, hepatitis A, in the market, but majority of children in many parts of the India are already immune to hepatitis A by the time they are 5 years old. So in India what happened, immune system is really powerful. You can see that foreign countries people are suffering more from corona, whereas the Indian people are not that much suffer from the corona, because our people already suffer from malaria so much, okay, in the past, and because of that reason already immune system is become so much powerful and we have less patient compared to the foreigner. Same way, majority of children in many parts of the India are already immune to hepatitis A. Already they are immune hepatitis A by the time they are 5 years old. So they are not suffering from the jaundice. Okay, most luckily, not in each and every case. This is because they are exposed to the virus through the water, and this is because they are exposed to the virus through the water. So dear student, today we learn about the principle of prevention. In that we learn about the vaccination and immunization. If you like my video, then like and subscribe my channel. Thank you for watching.